Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from our readers, and the question last week was: my 32-year-old girlfriend is in ICU. She stopped breathing after a heroin overdose. She's having seizures and is in cooling therapy. Will she need long-term care? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is: my dad is in intensive care on BIPAP for COPD. Should he be having a tracheostomy? This question from Emma is from a one-on-one phone counselling and consulting session with me. So, Emma describes the situation as follows. Hi Patrick, my 87-year-old dad is currently in intensive care and has been for the last 4 days. He's on a BiPAP machine with a face mask for high carbon dioxide, also known as CO2, as he has been suffering from COPD for a few years now. COPD stands for chronic obstructive pulmonary disease. My dad has been in good health generally speaking, and he has been living independently. About 12 months ago he has had cardiac surgery for an aortic valve replacement. He recovered fairly well and quickly from that given his age. However, his COPD has been causing more and more trouble since and has worsened. He is now at the point where he has been in hospital for about a month. Initially 2 weeks in ICU, where he was on the breathing tube, ventilator and in an induced coma. He managed to get off the ventilator. He was discharged to the ward. However, his CO2 carbon dioxide kept climbing and he got readmitted back to intensive care 4 days ago. As I mentioned, he's now back on a face mask for BiPAP and they are managing to keep his carbon dioxide down that way. His CO2 levels are climbing and are around 75 mm per mercury off the BiPAP. He also has a lot of sputum at the moment that he can't clear himself, and the doctors are telling us with a tracheostomy it would be much easier to manage the sputum as well. The intensive care team has asked my dad whether he wanted to have a tracheostomy, as they think that given his COPD and high CO2, he won't manage to get off the ventilator with a normal breathing tube. My dad has already agreed, but I'm having second thoughts and I'm not sure whether a tracheostomy will cause more suffering and just prolong the inevitable. What do you think? Many thanks from Emma. So, here is my response. Hi Emma. Thank you for your question and thank you for using my one-on-one phone counselling and consulting service. Your dad is in a very unusual situation given that he's tolerating the BiPAP and they're now wanting to do a tracheostomy. The reason I'm saying he's in an unusual situation is that most patients in intensive care go from a breathing tube to a tracheostomy and not from BiPAP with a face mask to a tracheostomy. It's good that he's agreeable to have the tracheostomy, and it's good to know that he knows what he wants. However, you, your family and your dad really need to think through whether he wants to go down that path. I guess what you and your dad would be looking for is if the tracheostomy will be achieving the goal to going back to a quality of life that is acceptable to your dad and to the rest of your family. It's obvious that your dad wants to live despite the challenges and setbacks he's currently going through, and he's obviously prepared to go through the procedure to have a tracheostomy without fully knowing what the outcome is exactly going to be. So your dad's worsening COPD will always push his carbon dioxide up, and he would be getting confused, lethargic and sleepy with an ongoing high CO2. A tracheostomy and intermittent ventilation would be a good management strategy to manage the CO2 and carbon dioxide effectively and keep it within normal levels. I fully understand your concerns that at your dad's age of 87 a tracheostomy would just prolong the inevitable. Now that may well be the case, however, by having a tracheostomy he's giving it the best shot, and you will soon find out if he can improve his situation or if he can't. But even if he can't improve his situation straight away, a tracheostomy will give your dad more time to recover and improve his CO2 and his breathing. A tracheostomy tends to leave a lot of flexibility around mechanically ventilating your dad when he needs it, and he can stay off the ventilator when he doesn't need it. Also, if he's currently producing lots of secretions, a tracheostomy will help to manage those secretions too, by having access to suctioning via the tracheostomy. Especially when patients are producing copious amounts of secretions with a weak cough, a tracheostomy is very advantageous to manage secretions effectively through suctioning. The next question you may want to look into and also discuss with your dad are issues such as the potential for end of life. Maybe your dad already knows that a tracheostomy will just prolong the inevitable. However, at the same time, he may not be ready to die yet, and he wants to have the tracheostomy to simply have more time. Also, quality of life is a very subjective experience, and what some people might find acceptable as for their quality of life, other people simply wouldn't find acceptable. It's really for the individual to decide what's acceptable for their quality of life, and by the same token, we simply don't know what our quality of life may look like after some major health issues and or critical illness. The same applies to you and the rest of your family. Do you want to have more time with your dad? A tracheostomy might facilitate this. And the good news is that it doesn't have to be in a sterile, depressing and institutionalized hospital or intensive care. Once your dad is having the tracheostomy and needs intermittent or even permanent ventilation to manage his carbon dioxide, he could still go home with services like intensive care at home. A service like intensive care at home is highly specialized to look after ventilated adults and children with tracheostomies at home, and it provides a genuine alternative to long-term stay in intensive care or long-term acute care. Therefore, in this day and age, a tracheostomy doesn't necessarily mean that your dad will spend a lot of time in intensive care, as long as you keep looking for the right options and as long as you keep making the right choices and decisions. I have also put a few links to articles and videos that will explain more about tracheostomy in intensive care and the options, because it sounds to me like you want to know more about whether tracheostomy is the right thing to do in the first place. So if you check out the written version of this blog below the video, you'll find links to articles like what are the risks and benefits of a tracheostomy, also tracheostomy and weaning off the ventilator in intensive care, how long can it take, and also the 7 answers to the 7 most frequently asked questions if your loved one requires ongoing mechanical ventilation with tracheostomy in intensive care. Again, Emma, doing a tracheostomy may well be the right thing to do. However, you and your dad also need to know about the risks and benefits. Generally speaking, we get lots of questions about tracheostomies, and it's a subject that we're highly specialized in. What's also important to know is that with patients with COPD, tracheostomy and ventilation, we have experience at intensive care at home to successfully make a transition home and improve our clients' quality of life, and in some instances their quality of end of life at home. We had a client at intensive care at home who spent a good couple of years at home after they had a prolonged stay in intensive care, and the gentleman had a tracheostomy, COPD, and needed intermittent ventilation. Him and his family were ever so grateful to have that time at home instead of in intensive care, and him and his family were very grateful that he could approach his end of life at home instead of intensive care. Maybe your dad is thinking along those lines. 87 years of age is not an obstacle to have a tracheostomy and then go home, even if it means your dad will need intermittent ventilation. By the same token, the intensive care unit might be in a position to wean your dad off the ventilator and the tracheostomy if they think it's achievable. If they can eventually wean him off the ventilator and the tracheostomy, he may be able to get away with intermittent BIPAP, also known as non-invasive or mask ventilation. And that can be done at home as well, and it's often mainly a nighttime activity. Especially during sleep, CO2 keeps rising if not managed appropriately with BIPAP. Therefore, if your dad chooses to have the tracheostomy, you now have a better understanding of what the options might be down the track. Also, last but not least, I would like to mention that a tracheostomy is generally not causing any discomfort or pain for patients, but is obviously a foreign body in a patient's neck, and I also need to point out that a tracheostomy obviously needs highly specialized care. I also believe that if your dad finds down the line that he'd rather not live with the tracheostomy once he has it, there would still be time to remove it and look at palliative care options. But for now, just keep looking at the positives, and for now my advice would be to support your dad in his decisions, because I'm sure he hasn't taken those decisions lightly. I wish you and your family all the best. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.